Hi, everyone. Welcome back to Michigan 2-in-1's From Hello to Help, a podcast series that aims to engage in meaningful conversations about health, human services, and resources essential to the daily lives of Michiganders. I'm your host, Sarah Kyle. Today, we're talking about substance use disorder and recovery, focusing on the reality that anyone can reach out for questions and help, regardless of where they are in their journey. We want to tear down the walls that keep people from seeking support. And joining me today is Derrick DePetro of Great Lakes Recovery Centers. And I am thrilled. Thank you so much for joining us, Derrick.
Yeah, I'm glad to be here.
Great Lakes Recovery Centers offers a variety of services, including crisis intervention, residential treatment, outpatient, and we could go on and on. They really have created a continuum of care for individuals affected by substance use and mental health challenges. In this episode, we're going to cover the scope of addiction in our communities, the importance of early intervention, what recovery might look like, and just have a conversation. Let's demystify all of this work. Derrick, would you mind starting with an introduction of what you do and what happens at Great Lakes Recovery Centers, maybe your mission? My friend, let's brag for a minute about the hard work that you guys are doing up there.
Absolutely. So we are located in the Upper Peninsula. So all of our services cover the 15 counties up here. And so we currently have 5 residential programs. We have 1 adolescent where my background comes from. I've been with our adolescent residential program for 21 years now, serving the kids here. We are currently the last standing private pay and or Medicaid funded residential. So we're trying to serve the entire state of Michigan right now for residential treatment. We also have 2 men's residentials. We also have 2 female residential where they're also able to bring their children up to a certain age to treatment with them, which is a nice thing for moms. We have outpatient services through a majority of the 15 counties. There are a few that we aren't in. And we've branched out into a lot of other things that maybe aren't as common, such as offender success. So maybe those that are returning from prison and trying to re-enter into just general life again. So there's supports for them. We also work with foster care and trying to recruit parents to be and to support them to be foster parents, working with MDHHS. We have your traditional outpatient services and for both mental health and substance use. And another program that I also work with is we're trying to work with what's called day treatment program that is a specialized education program with one of our local districts here to have those kids who maybe aren't quite making it in a traditional school to have specific services there with intensive therapy as well. So that's a brand new pilot project we've been working on for the last couple of years.
That's a lot of work. And having come from the field of substance abuse prevention, which is one of my first careers, and I worked in a continuum of care here in mid-Michigan, I know that every single one of those programs is miraculous, the amount of work that goes into them. But I also know substance abuse impacts all of us, every family I know of. Can we start with, let's demystify, there's no stigma. This is, a mental health disorder, again, that impacts many of us. What messages do you share in your community to make sure that when someone is wondering, they don't think that they're the only person who might struggle or their family's the one alone? Are there any messages that you might share with us?
Yeah. So one of the biggest things that I've learned early in my career is that addiction knows no faces. And the reality is that it doesn't matter who you are, what you look like, your social class. It doesn't matter if you have tons of money or no money. It doesn't matter. Like it's a human thing that we all struggle with. And so it can impact any one of us. And it could start extremely early on in the adolescent period, which is where my background comes from, or it may come later in life for different reasons, and you might find yourself struggling with addiction.
Yeah, and I do like that. There is no common face, no common age. This is really impactful for all of us. If I'm going to make a call for help, if I'm in the Upper Peninsula and I'm calling your organization, maybe I have the courage, I call 211. What do I need to know when I make that first call?
I think the first thing is just knowing for yourself that I need to make some type of change or something doesn't feel right, and reach out. Like, it really doesn't matter at the end of the day who you're reaching out to, as long as you're taking that first step to reach out to somebody. So, as part of my role as the director, using the residential as an example, I talk to mainly parents, probation officers, sometimes kids. I might be on the phone for a half hour, and 20 minutes of that conversation is hearing the stories, because nobody's calling for help on a bright sunny Tuesday because it seemed like a good idea. There's usually some type of crisis that usually comes with that, and a lot of unknown, like, what do I do? And so to just have somebody on the other side of the phone to just listen and help you navigate this. Because if the substance abuse or substance use was an easy channel to navigate, we probably have a lot more people using the system. And I think even the state of Michigan's trying to look at right now, what do we need to maybe do differently? Because it isn't always super simple to get into services. So reaching out, I think, is the big thing. And whether it's a 211 or any program, throwing in Google just resources, different communities, what type of therapies you have going on. Like, there will be somebody on the other line who will help navigate.
And thank you, because I would 1000% agree. We take very seriously, I'm sure, as you do, and every human service organization, that it takes courage to ask for help. It really takes courage. And once you do that, it can be empowering, and we do take it seriously. We hoping always to offer, obviously, dignity and respect. Can you tell me a little bit more about, like, beyond treatment? That's where you guys are here, and all the programs that you have. Talk to me about what's happening in our communities. What does recovery look like? Maybe if I've been through clinical treatment and I'm on my path to recovery, what does long-term recovery look like? Does your organization help clients with like, talk to me about what's after treatment.
Yeah. And so I think the nice thing with that is, there's a term, many pathways to recovery. And I think that's super, because, like, what works for one person may not necessarily work for the others. If we go back years ago, so, like, how treatment centers really got started was two people trying to stay sober at an AA meeting. Like, that's where our field came from. And then early people, or those that the counselors were just people who had more sobriety over maybe somebody else. And so we were morphing over the years. And so I think one of the big things that's important with this is just that not everything works for everyone the same. There are some people, I think we're super worried. Okay, abstinence. Yes, that might be best for some people. That may not be everyone's trajectory that they're on. And so those in the field are going to work with you on what's best and what your circumstances are, because at the end of the day, we want you to be healthy. Now, that's a very broad term. And so what does healthy necessarily mean? It's going to be individualized to you.
And isn't that the beauty of being individuals, is that something that works for you may not work for me, but if it works, it's going to work. Can you talk to me about, if I'm an employer, is there a way to encourage those who, I may have no idea, but it's very likely, depending on your size, that you have someone who's in recovery, either your employer, maybe a community group. How can I, as an outsider, support those folks who are on a recovery journey?
Yeah, I think one of the biggest aspects as far as supporting people is connecting with your community. So if you're somebody in recovery, There's ways to volunteer and help out. I think residentials a lot of times need more support than, say, maybe more of a traditional outpatient. They might need things to help people get started. Looking sometimes at an adult, they may be coming into treatment with the clothes on their back, so let alone having a place to stay or whatever might be going on. And so connecting with your community, looking at the resources and being able to kind of give back that way really gets missed a lot. Anything from donations to sometimes even food. I know here with the kids in particular, our role and what we try to do is get the kids out into the community, because with substance use, there's so much shame and low self-worth that are tied to it. And so our goal is to try to get them in the community to help them realize that their self-worth is so much more. And so different partners that we have in the community, and it really raises their self-worth to realize that they're more than just the substances that they use. And it may not even be substances. It could be food. It could be, gambling. It could be a lot of other addictions. And so this really helps them feel connected.
I couldn't have stated it better, and I couldn't have guessed how beautiful the answer is, especially this time of year when we start to think about how do we give back, and is our recovery community on that list of folks that we give back to.
Yeah.
That's beautiful. Thank you. And I do think you're right. Very few things feel as good as getting out in our communities and giving back, whether you're on the recovery journey or you want to support those. And those are ways that you can also, I'll bring it around to use 211, right? Because a lot of folks don't know they can use us to find volunteer opportunities or opportunities to donate, find organizations like yours where maybe I want to go in and and serve, or make sure those who are in residential have something a little special from their community. So that's beautiful. Thank you. Can I ask about, we're coming up on like a dry January, and it is a very interesting concept, of like a reset.
Yep.
And it can be positive for a lot of people, but also it can create like, man, I didn't know how hard this might be. Are there any things that I should be aware of? Like, I know you had said just reach out, but is there more that you can give me on that?
Yeah. So, depending on everyone's internal use. And so we'll leave that general and whatever you might, because dry January could be a lot of things. If we look at individually, maybe you're trying to stop something else that isn't necessarily a substance.
Right.
Say it is a substance. One thing you want to be cautious of, if you're overindulging and you're doing it daily, you're doing it a couple times a week. And when you go from doing something regularly and then you decide to stop abruptly, the body kind of has a lot of connections, and it also starts to respond in a way that could be harmful. And so one thing you want to be watchful for is what we would call withdrawals. You wouldn't want to put yourself in a situation where there's some serious medical issues that could happen if you are using or indulging pretty regularly. So that would be something you want to watch out for. Also, through dry January, if you decide, I'm just going to make a change, I think you're going to see a lot of things happen, mentally. Maybe there's a certain reliance on a substance to help with some of the moods or the social interactions. And so you may find that it is a little bit more challenging to complete your daily tasks or life without that present. You also might feel like $1 million and things are great, and your mental health, you feel like it's improved, and maybe decide not to do that. And so I think it dry January, if you decide to make any type of change, is going to give you an opportunity for growth. And you're going to learn a little bit about yourself and however you choose to take that.
That's a beautiful answer. And as we wrap up, I want to say one more time, I'm just thrilled to have you here. But I want to hand over, before we do wrap up, Is there anything else that you would share with us? Is there anything else you'd share with our audience? I know it's already been hard hitting, like just reach out, do it. There's no shame. We're here, all these things. But is there anything that you're like, man, Sarah, I just want to make sure your audience hears this?
Yeah. So, one thing in working with adolescents, they have a hard time understanding this concept of addiction. And so to really simplify this, whether it's for young people or older people, addiction's kind of like an allergy. Okay. There are some people in the world who can, eat peanuts, and there are some people in the world who can't. There are some people who have grass allergies versus this. Like their body, it just rejects it. And so substance use and addiction is very much like an allergy in the sense that some can do it and not have major reactions, and other people, their reactions maybe isn't that they got a rash, but maybe they're out doing illegal things, or they've lost their jobs, or their family discord going on. And so to really simplify it, some of us can, some of us can't, and it's similar to an allergy.
That's profound. And I think it's more profound than just a sentence, but it's beautifully worded. Thank you. Derrick, for your time, for your insight, your dedication, for work that I know is hard. Thank you. Thank you to you and your center for what you're doing.
Thank you.
If you're out listening and you're thinking that you or a loved one might need help, please don't wait. Reach out. There are resources available. There are folks who want to talk to you. And there's a wide variety of people who understand and can help. For those of you who might want to help others or to find information about the continuum of care, please visit greatlakesrecovery.org for more information. To our listeners, if you need information on resources for substance abuse, mental health, or other human services, we encourage you to get in touch with 211 for access to the appropriate service for you. Don't forget to follow us on social media. Visit our website at mi211.org for more information on all of those resources, including those represented today. Thank you for listening, and we look forward to having you with us next time on From Hello to Help.